Hi there, and thanks for joining me today. I'm Jim Lawson, ABC's Outreach Development Manager, and I may have met some of you or most of you at a state, regional, or national meeting sometime over the past 11 years. Normally, I talk to business owners and managers about how they can be compliant with ABC's and Medicare standards. Not only that, but so they can be compliant with our accreditation requirements, but so they can improve their business process, they can better serve their patient population, and hopefully grow their business. But today, I'm going to be spending the next 45 minutes or so taking a deep dive into the topic of privileging and how it can help expand your business. Now, before we dive in, I wanted to go ahead and mention that we have a quiz that you can take after the webinar to earn 1.5 continuing education credits. You simply click on the Take the Quiz link next to the webinar on our webinar library. We also have the slides for the presentation there. These slides you're about to see, just click on the Download the Handout link and you'll be able to get those slides right away. I did want to mention also that the mastectomy fitter credential is the only exception for privileging, but the privileging process we're going to discuss in this presentation today will still apply for mastectomy services. Okay, so to get a better grasp on privileging within the orthotics, prosthetics, and orthotics profession, we're going to take a look at what privileging is, who can do it, how it should be done, and other options available for extending your practice's patient care. ABC acknowledged privileging for many years. We've done that for many years, and it can be certainly a viable way to assist you and your staff in running your day-to-day business. Now, I get to speak with many O&P professionals often, and I find that there's still a certain amount of people who find privileging confusing or maybe even aren't aware what privileging is. So we thought this was time to review the topic again. We're going to discuss the importance and explain exactly what privileging is, who can be privileged, the importance of how it should be performed, and the specific documentation that's required to be compliant with the ABC's accreditation standards. So, let's go and start with the basics. What is privileging, right? In ABC's Patient Care Facility Accreditation Guide, it states in Standard HR.6, and I'm going to quote right here, "You may privilege certified or licensed staff to provide patient care beyond their defined scope of practice under the supervision of a certified or licensed individual practicing within their scope of practice. If you privilege a staff member, your process must be in compliance with applicable laws based on written objective criteria and under the indirect supervision of a certified or licensed individual practicing within their scope of practice," unquote. Oh, big breath. So, as I mentioned that the individuals involved in privileging can be either ABC certified or licensed, right? ABC's accreditation standard, we recognize licensed O&P staff the same as certified staff. An O&P licensed individual meets ABC staffing qualification requirements. But I'd also like to encourage you, if you practice in an O&P licensed state, that you make sure you are familiar with the state's rules on privileging. Some licensed states permit privileging, but some don't, or have they stipulations that they must follow. Now, as of today, there are 15 licensure states across the United States. Please, I ask you to review their rules and regulations, because licensure trumps ABC's accreditation. Licensure means that the governor has created a law for that state, right? You can view the licensure state at abcop.org. You'll find this map that you're looking at right here. Look at the states on the map. Click on the state, and it'll give you the link to that state's licensure website to review their rules and regulations. We just want to make sure that everyone is following exactly as you need to follow. So, what exactly does that mean? It means that a certified or licensed staff member can be privileged or able to provide items or services beyond their scope of practice. Let's think like this. Think apples to apples, with apples being certified or licensed individuals and orange being non-credentialed individuals. Apples to apples, yes, to privileging. You may be privileged. Apples to oranges? That's a no-go, right? It sounds rather simple, doesn't it? Well, it is, but there are very specific ways of becoming privileged and very specific steps that must be taken before someone can be privileged. There are also very specific policies that must be adhered to when they're performing their privileged work. We'll get into those. So who can be privileged? Well, we already answered that question in ABC's definition of privileging, right? Little long-winded, but let's reiterate. Only certified or licensed staff members can be privileged, and those doing the privileging must also be certified or licensed. That would be the supervisor. There are other options for non-credentialed or non-licensed staff, and we're going to get into those a little later on. Now that we know what privileging is and who can do it, we're going to spend most of our time today talking about how privileging should be properly done. So, when a credentialed or licensed employee is privileged to provide services beyond their scope of practice, it must ensure appropriate, effective, ethical, and safe delivery of patient care. That's extremely important. It must also be done under indirect supervision and based on written objective criteria. Now, we'll talk about written objective criteria in a bit, but first let's go over indirect supervision. Indirect supervision is just as it sounds. Supervision of someone without being directly or physically next to them. So, what would be acceptable indirect supervision options? How about using a cell phone? It's a perfectly acceptable option, but most of us have FaceTime and Skype or other virtual platforms on our phones or tablets that allow us to give as well as receive supervision in real time. So we're talking real time, okay, at this moment. So video calls are a very good option as well. Another option for indirect supervision involves the supervisor being on location. They can be treating another patient, but available for any consultation and supervision if needed. So indirect supervision does not require the supervisor to be on site. However, they must be available for consultation throughout the patient care process. You can't consult with your supervisor before or after a patient's appointment. It must be during the time the care is being provided. Very important. Now that you know what privileging is, and privileging employees must be supervised under indirect supervision, and what methods are acceptable, let's look at what we must have in place before privileging someone, okay? This is where the written objective criteria comes in. The criteria is basically the justification and documentation needed for privileging someone. More specifically, it is defined as how a privileged caregiver's ability to provide specific patient care service has been assessed and documented. Now, don't worry. It may sound a little scary, but I'm telling you it's not. So I'm going to break it down and give you a lot of examples. Basically, a written objective criteria is the structure and mechanism of the caregiver has gained the necessary knowledge and skills to be able to provide a specific patient care service outside of their scope of practice. And let's break that down. So, the written objective criteria needs to be clear and related to the diagnosis involved and the orthosis or prosthesis being provided. Now, I think it's pretty obvious this family is clearly related, right? Okay. We need to see that as well with your written objective criteria and the diagnosis or device referenced. And you will need written objective criteria for each diagnosis and device. You may be asking yourself, what kind of proof and documentation is needed to show the privileged employee that has been trained? Are you asking yourself that? Good. I like the way you're thinking. Let's break this down a little more. The documentation for a written objective criteria that is required may take different forms, including, but not limited to, proof of completion of continuing education courses related to a specific diagnosis or device. It can be documented in-house training or in-services that are specific to the patient care service that the caregiver is being privileged to provide. So if a manufacturer comes into your practice to provide training, that counts. Another option can be documented specific work experiences participating in patient care activities. You may have an employee that has worked for you for 3 years and you've trained them on specific diagnosis and prescribed device, and perhaps they have even observed you working with the patient with this diagnosis or device. Now, these are just a few of the examples. If you have other documentation, that would be provided as well. So we've been through the technical explanation, but let's use a scenario as an example. If you have been privileged to provide a custom PLS AFO to treat dorsiflexion weakness in a stroke patient, now remember, that is a very specific diagnosis. That does not mean you're also privileged to provide an Arizona AFO for treatment for PTTD, posterior tibial tendon dysfunction, okay? You can be privileged for PTTD as well, but that would also need a written objective criteria. So what I'm saying is you are privileged for a very specific task, for a very specific diagnosis, and a specific device. I can't overemphasize that. If you wish to be privileged in other tasks, like I said before, you will need a written objective criteria for that task as well. Now, there are different options for documentation we've been discussing. One could be a certificate of attendance for a training course, and this documentation here, along with the rest of that documentation, would live in the personnel file of the person being privileged. A log or checklist wouldn't be adequate documentation by itself. That can be very good documentation, but not on its own. There needs to be other substantiating documentation that supports what is described in the log. So let's discuss some of the different pieces of information and documentation that should be in the written objective criteria. Remember, this documentation is something that can continue to be added to grow. This is a living documentation. So here's what we need to see. Content. What is the specific diagnosis being treated? What is the specific intervention being learned? Let's look at the format. Where did the learning take place? When did the learning take place? Who was the preceptor and which organization did he or she represent? And how about the process? How did the privilege progress from observation to assistance to independence? To reemphasize, here's a great example of a living documentation for privileging. It is telling us the story of who, when, what, and it is very specific to a diagnosis and device. So if you see here, Joe is being privileged, and here is his story. It tells us what he's being privileged in, his training, who has done the privileging, and who has done the training. It also tells us Joe's progression throughout his privileging process. Once again, all privileging must be specific to the type of item and service being provided. Now, additionally, we need to see the justification for needing the privilege as a team member. Why are we doing that? Why did you make the decision to privilege someone? Maybe you, as the supervisor, are with a patient with a more difficult diagnosis, and a privileged team member could provide health care for a patient with a diagnosis they are privileged in, thus seeing two patients at the same time. Maybe you travel between different offices and aren't always able to provide the health care needed at the time. Privileging a team member could be a very beneficial way for your business as well as for your patients. It could be less time waiting for your patients. That's not a bad thing. You may be saying to yourself, but Jim, wait a second. We have some uncredentialed staff members that we'd like to utilize. Since privileging is only for credentialed staff members, what are those uncredentialed staff members able to do? Well, please have no fear. Each of your staff member has a role to play in the healthcare that you are providing. And here are some of those options to consider. ABC does allow for tasks to be delegated to non-credentialed staff members, which we refer to now as support personnel. It's an extremely important title, support personnel. There are many tasks that they can perform. Let's take a look at some of them, what they can do and what they can't do also. An ABC credential holder can delegate certain tasks to a non-credentialed support personnel. Now, I do want to remind you that when I use the word delegate, right, I do not mean privilege. Delegate is not the same as privileging. Now, the task that ABC credential holder delegates to support personnel must be within the credential holder's, that's supervisor's, scope of practice, and they can only be for the provision of custom fabricated or fitted devices. For example, a certified prosthetist, a CP, would not be delegating tasks for orthotic devices to their support personnel. That makes sense. If you remember in privileging, the supervision was what? Indirect. Well, for support personnel, the non-credentialed person, all supervision must be direct supervision. So let's take a look at what is direct supervision. ABC's definition of direct supervision is rather easy to understand. Direct supervision means that the supervisor must be available for consultation throughout the patient's care process. Not only must they be available, they must be physically on site while the health care is being provided. There's a big difference right there, physically on site. They must also review results of care and documentation for the service rendered, and this is also important, they must countersign within 15 days all support personnel notes in the patient's records. Now, what tasks and responsibilities can and cannot support personnel provide? They can provide certain tasks in the provision of any custom fabricated or custom fitted prostheses, or podorthic device. This includes taking patients into the exam rooms, taking their vitals and specific information such as weight and blood pressure. They can also assist the certified staff with implementing the patient treatment plan. Now, implementing the patient treatment plan. They can also record outcome measures as well as taking the patient's vitals, as I mentioned before. Because support personnel are not credentialed, there are tasks that they cannot perform, such as patient assessment and formulation of the treatment plan, final fitting and delivery of any follow-up care that modifies the function of the device as originally prescribed. Again, those delegated tasks must be within the ABC credential holders, that supervisor's, scope of practice. Here's an example that may help you better understand what non-certified or non-credentialed staff members, support personnel, may do. Okay, let's take an OTS, off-the-shelf items. They can be dispensed without a credentialed person having to provide the care. Now keep in mind that the documentation requirements are all still in place. For example, there has to be a prescription, delivery receipt, proof of providing instructions to the patient, etc., etc., etc. Now see, this is an L1833 knee orthoses. It's prefabricated device, right? Which a support personnel could provide. Here's another example of what support personnel can provide. Any L code that has OTS, off the shelf, in its descriptor does not require a credentialed person to provide this device. So, a support personnel would be able to provide this device. But again, I remind you, just as I said before, that the same documentation requirements are in place, that prescription, the delivery receipt, proof of providing instructions to the patient, all of the rest, all of those are still required no matter who is providing this service. One thing that those who are privileged and support personnel have in common is how their credentialed supervisors must review their work. Those are the supervisors, right? So just as those who are privileged, the supervisor must review their notes and the patient's charts. They must countersign and date those notes within a 15-day period. Just as those who are being privileged, the buck stops with the supervisor. And when they sign the dates and charts, the supervisor is basically saying that they are agreeing with the work that has been completed and documented. Now, have you ever considered helping a support personnel employee earn a certificate and certification of their own? I'd be remiss if I let this opportunity go by without sharing with you the options for ABC certifications. There are many certification options for support personnel to explore that don't require a college degree and can be earned while still working full-time. Let's go ahead and take a look at some of those options. ABC offers certification not just for practitioners, but for the following disciplines: O&P assistants, O&P technicians, orthotists, orthotic fitters, mastectomy fitters, and therapeutic shoe fitters. Each of these disciplines has its own level of healthcare they are able to provide under their own scope of practice. Each requires a level of education and or training and taking and passing the appropriate ABC certification exam. We could probably spend a few hours just on this subject, but to save us a little bit of time, you can find all of these prerequisites and the scope of practices on our website at abcop.org. I'm going to show you that website again a little later. Also, if you have further questions about this, please don't hesitate to reach out to us. Once again, I'll give you our contact information at the end of the webinar. Let's go ahead and recap what we've learned, some of the do's and don'ts of privileging. Hopefully you have a good grasp on privileging now. One time, let's review what we can do and what we can't do with using privileging. You need to make sure all of the sufficient documentation needed for privileging, training, justification, and written objective criteria, right? We need to be continuing and to be educated and keep up with new procedures, technology, and standards. Being privileged follows along the same line with your ABC certification, so you need to reach your CEU minimum goals every 5 years. You need to continue to update any privileged staff member's education as well. The supervisor needs to be available for supervision and consultation with credentialed caregivers, as well as non-credentialed caregivers and non-privileged caregivers. The supervisor needs to review, co-sign, and date the privileged staff member's notes within a 15-day period, as I mentioned before, but I suggest you do it as soon as possible. Now, I haven't mentioned this yet, but if your facility is accredited with ABC, ABC Surveyor will be reviewing all privileging documentation during your next and following ABC accreditation surveys. This is something to keep in mind and be ready for. Now, some of the things you don't want to do is become comfortable with your privileged staff members and the services that they're providing. As the supervisor, please don't get comfortable with that. Be aware of what they were doing and how they're doing it. Once again, I can't emphasize this enough. Their work is basically your work because it is being provided under your certification. You must really take this very, very seriously. Here's another thought. If you, as a supervisor, don't feel your employee has enough experience or training in what you'd like them to be privileged in, if you don't feel you have sufficient documentation for privileging of a credentialed employee, my advice to you is this: hold off on it until you are confident you have the appropriate required documentation and the credentialed employee has sufficient training and experience. Again, seriously, that's very important. Privileging can be a great asset to your business when it's done properly, and it can be a big issue when it's not done properly. I often get asked if a resident needs to be privileged. Now, a lot of you will have residents in your practice. You have your resident program. Residents, no, do not need to be privileged because they have a separate definition in their scope of practice, and they are supervised by the residency directors and residency mentors. So residents do not need to be privileged. So if you have residents, don't worry about privileging. They do not need that. How does this affect residents between their completion of their residency and when they become certified, those candidates? Yes, getting ready to take the board exams? Again, it doesn't affect them at all. Privileging rules for non-credentialed staff does not impact exam candidates. Those are those who have been applied to take the exams and been accepted. They have a separate definition in the scope of practice. They're supervised by a certified licensed practitioner in the discipline that they're practicing, so privileging does not affect those candidates for the exams. Well, I hope this webinar has been informative and it's helped you with your privileging practices, okay? If it hasn't, watch the thing again. Hopefully you'll pick something out each time you listen to it. Remember, to receive your 1.5 CEUs, your continuing education units or credits, for this webinar, click on the link under this webinar in our webinar library to take the quiz and receive your credits. I would also like to remind you that all of the information we've been discussing today can all be found on the ABC website. Once again, as I mentioned before, you can listen to this webinar again, but everything we've been discussing is on the ABC website. That website is right here in front of you, abcop.org. Plus, the contact information for all of our staff members is there too. Take a look at there. You see, that's me holding the sign right above the letter A. Yes. Now, speaking of staff, if you have any questions about how privileging applies to your practice, you can reach out to our accreditation team at accreditation@abcop.org. Plus, if you have specific questions about scope of practice, state licensure, or how to certify support personnel, remember that list that they can become certified in, you can reach out to our professional credentialing team at certification@abcop.org. And of course, I am also very happy to answer any questions you may have, or I'll get the right team member who can answer your question if I'm not able to do so. And my email right in front of you there is jlawson@abcop.org. Now, I would also love to hear from you. If you have any suggestions for future webinar topics, please, please, please just email me and let me know what they are. We'd like to hear from you. Once again, thank you so much for joining us for ABC's webinar series and this episode on privileging. Have a wonderful day.